Thank you, Sarah, and welcome back to our viewers joining us for the special talk element of our DW News coverage at a very crucial time, a very tight race. And around the world, we're taking a look at the issues shaping this year's U.S. election. We've talked about the divisive language of politics, inequality and civil rights. We've talked about global policy, foreign policy. And now, another crucial topic, the COVID-19 pandemic, especially a look at mis and disinformation in such a critical health and economic crisis. And I have three guests joining us for this discussion. Andrew Ullmann is a member of the German Bundestag for the business-friendly FDP, the Free Democrats. He is also a doctor, internist, and the head of the Health Committee in Parliament. He's joining us from Berlin. Thank you for joining us, Dr. Ullmann. We also have Folakemi Ezenvane. She's a frontline health worker and the founder and CEO of Proactive Healthy Women in Nigeria. She's joining us from Lagos. Great to have you as well. And we have Stephen Eugene Kuhn. He's a U.S. Army combat veteran, having served in the Gulf War and in Iraq. And he is now a consultant and an author, and he's joining us from Budapest. So great to have all three of you. And Mr. Kuhn, I want to start with you because you have supported President Trump's handling of this COVID-19 pandemic. So tell us why that is. What do you think that the President Trump's approach is here that has been a positive?
Well, I think anyone can see that this is a worldwide epidemic, number one. Number two, this is not a partisan issue. It's a bipartisan issue. And with the information that President Trump had, he did the best job that he could. Now, moving forward, things changed, and he changed as well. And the one thing that I got to say is that seeking solutions is always more important than seeking what not to do. You understand? So he keeps moving forward, looking for different ways to handle the situation, while, unfortunately, the other side, if you want to call it that, is looking at what he shouldn't do instead of providing solutions. This is a bipartisan issue that must be solved by both sides.
Okay, Mr. Kuhn, you're saying it's a bipartisan issue, but we've heard President Trump time and again point to Democratic or blue states, especially in the start of the pandemic, accusing them of not handling this the right way. And you also mentioned that he did what he could with the information he had. I mean, we know that early on in February, because of these audio recordings with the veteran journalist Bob Woodward, that President Trump downplayed the pandemic. He called it the plague. He said he acknowledged it was deadlier than the flu, but that was not the messaging we heard in public. So what do you mean by the fact that he handled it as best he could have with the information he had?
Well, it's a balancing act, isn't it? You can't go out on TV and scream and yell, "We're all going to die." This is obvious. He wouldn't do that to the American people. It's about finding a measured response to all of the information that he has at one time. And basing the decisions on solid science. But there's different kinds of schools of science. We have career government officials dictating lockdowns based on only one side, science, and then we have, the frontline doctors. We have the epidemiologists, and we also have the academics that are making a lot of these decisions as well. So instead of listening to one person or hearing one way, he tries to find every sort of situation from every single, let's say, thought of science. And my belief is this is all. His goal was to relieve suffering of all Americans, because again, this is hitting every American, not just blue, not just red. It's key to take all these factors into account and not just always pushing on one side. I think it's key that we come together on this issue.
Okay, Dr. Ullmann, I want to come to you in Berlin to ask you that question about the role of science. How do you see this yourself as a doctor, as a physician who has been working with the Health Committee in the Bundestag as well, tackling this pandemic?
I think we all have to appreciate there is no one science. When scientists debate or discuss facts, sometimes the results are different, or the results of the discussion might be different, and they have to be weighed very carefully. One might be helpful or not. But one thing is pretty sure here during the pandemic worldwide is that nobody really has the one solution how to tackle this pandemic. We have to understand, though, that tackling this pandemic can only be done globally altogether. And it's important that we try not only to contain the virus. I think that's way past already. We have to mitigate everything possible to be sure that this virus is not spreading any further. We need to bring down the curve for very sure. However, we have to clearly define the aims that we are having. And it's not really quite sure what aim every country has. Even here in Germany, we have different approaches how to contain this pandemic.
But Dr. Ullman, I want to ask you just as a follow-up, I mean, how do you see President Trump's messaging on COVID-19? We have heard some back and forth over the course of the past year as the U.S. has been dealing with this pandemic. And do you think that's been harmful?
I would agree. I think it is harmful because what I heard on television is that he's twisting the facts. The facts are being twisted around to see more the optimistic view. I understand to relay an optimistic message. However, you have to be realistic at the same time. And telling the American people that the Americans are at a turning point, that the numbers are getting better, despite the facts that are differently, I think that's not a responsible politician how to react to the situation of a pandemic. So he needs to get the numbers straight and has to relay those numbers correctly, and do not question, for example, masks. All of a sudden he was making jokes of people carrying masks, and all of a sudden he was infected with COVID-19 himself. So I think that is really troublesome, that facts are twisted around.
I think the numbers speak for themselves.
Okay, I want to bring in Dr. Ezenwane. Just one moment. One moment, Mr. Kuhn. I just want to make sure we bring in Dr. Ezenwane here, sure, also as a frontline worker on COVID-19. And I want to ask your experience as well in dealing with mis and disinformation and confusion about what science says. I mean, how has that affected your work in Lagos?
I mean, for here in Africa, especially Lagos, Nigeria, most of the people have looked to the news, and it's been amazing when, it was funny when, the president said, oh, chloroquine could cure it. I remember people, running to the pharmacy, especially here where, there's no proper drug regulation. People can get over-the-counter medication without proper prescription. And we had, cases where chloroquine was sold out in pharmacies, and there were even cases of people having chloroquine overdose that were admitted in a hospital. So I think it's really important, that the correct information is spread, because it really spreads like wildfire, and for here in Lagos, Nigeria, most of the cases we've seen are also people not believing the facts and the figures, thinking COVID is really a fluke, and especially when they look to the news and they hear the president, of another country saying, oh, it's just something like the flu. So they're not taking it seriously. They're not taking the social distancing measures, wearing of masks really seriously. And we're seeing the disease spread, even though we've not recorded as many deaths as has been recorded, in the Western world, but we've still seen quite a number of deaths here.
Mr. Kuhn, what's your response to that? We just heard Dr. Ezenwane saying people in Lagos are looking at their TVs and seeing the president talking about certain treatments that haven't been proven to be effective and might even be dangerous, and are running to the stores to try to get that treatment. I mean, isn't that exactly the wrong approach?
Well, again, you have to look at where do people run to and where do they run away from. People run towards hope, right? So, I mean, if there's a case where something new comes out and we don't give it a chance. Okay, I'm not defending the way he says things or the way that his crassness of his voice and things like that. I'm defending the fact that you have to seek solutions. And as far as the numbers go, from over 10 countries where statistics are taken, you have to take the mortality rate, the positivity rate, and the new testing rate in order to see the real numbers. And in the real numbers right now, the deaths in Sweden between April and October is down 30 times, not 30%, 30 times. It's 10 times less than Germany and in Italy. And in America, it's 3 times less than April to October. So these are numbers that, yes, we do have to face the facts. But if you're only saying new cases, you have to compare that to the new testing, the amount of testing. If we do 5 times more testing, we're going to have 5 times more cases. So yes, facts are important, but all the facts.
Dr. Ullman, can I get your take on this? Because, there in Germany, we have also seen a new outbreak of cases in a city like Berlin. And there have been protests in Berlin against some of the measures in place. So there's also a distrust of science and of some of the experts who have been leading the charge in Germany. So is that just proof that it isn't necessarily just President Trump alone here in questioning some of the approach?
Well, of course, in a democracy, there are always different opinions. You have that in science as well. We have some professors here, but very, very few, a handful that see it differently. But what we just heard about twisting the numbers, this is what I was just talking about. Mr. Kuhn was just talking about relative numbers, but if you look at the numbers of the density, how many deaths per inhabitant, Sweden is doing horrible. And Sweden didn't take appropriate precautions, and now they're switching the gear and say, okay, we do have to protect our population. So there's a way to look at the numbers and interpret those numbers correctly, and they were not interpreted correctly. Due to the protests here in Germany, of course, we have those protests. This is a very small minority. However, they are dangerous insofar that they could really speed up the infections that are happening here in Germany. And of course, even our government is not really clear with the measures that they take because they're in part not very logical. This is what I'm actually complaining about our government here in Germany, that a lot of measures that they take are not logical, and they should be logical and be scientifically sound. They are not all sound, to be honest.
I agree. 1 million marchers in Berlin is not a small amount, unfortunately. That's a lot of people, 1 million people marching. There's 800 doctors and scientists filing a class action lawsuit against the German government right now.
People. Don't get the numbers correct. We're talking about a few thousands.
Let's bring Dr. Ezenwani back into this discussion because she's a frontline worker here.
No, they're not.
All right, let's bring Dr. Ezenwani back in here with her perspective from Lagos. What do you have to say about this?
Right now, we've had protests, there's been a lot of social unrest. And we're also seeing a rise in numbers here. The numbers had gone down, and it seems like there's a second wave. Younger people are dying. So I'm not sure if, it just feels like they're not taking the measures that have been put in place really seriously. The government hasn't really, put stringent measures in place to make sure that, they curtail the curve of this virus and that people take it really seriously. We've had cases of people that are younger, even without any coexisting conditions, coming down with the disease and even dying from the disease. But we're hoping that, we're hoping that there is no second lockdown. We've seen that, other countries are already imposing a second lockdown in place, and we're hoping that people would really, really, abide by the measures that have been set in place.
The measures being set in place, if I may.
And Mr. Kuhn. Go ahead, Mr. Kuhn.
The measures being set in place are being said, well, they're measures, but they're actually hardcore draconian lockdowns in some places. Germany just went into a lockdown that was already known 2 months ago that it was going to happen. So this game that we're playing saying, yes, well, we have to react. No, this was already planned 2 months ago. Middle of August, we already knew this was going to come. We actually had dates. So, and let's look at what's actually happening.
Is this true with Dr. Ullman?
And fear. Oh, he's going to say no, of course.
Well, the information that I have, this is what I would wish for my government, that they would plan in advance. But there was no 2 months ahead of time. We got the information all last week, where the minister presidents of the federal states in Germany, as well as the federal government, sat together and came up with this so-called lockdown light. I would certainly agree with my government if they would say we have to follow the physical distancing more closely. We have to protect the vulnerable people with a very intelligent and smart test strategy. But locking down, for example, the restaurants doesn't really make sense because they had very good and viable or reliable hygiene rules set up, and they were controlled. Now the uncontrolled environment goes into the private places, which I'm concerned about. And there is no conspiracy here that this was a long-term plan here in Germany.
It's not about a conspiracy. It's simple facts. It's simple facts.
No, there are no facts. Sorry, where did you get that information? I'm sitting here, even though I'm an opposition party. Where do you get this information? You just say, you just said just a couple minutes ago, there are millions of people protesting here in Berlin. This is not the case.
Gentlemen, let's let Dr. Ezenwani say a word here as well.
Apparently, I think what we've seen with most governments is that they've been reactive rather than proactive. A lot of people, a lot of the waited, shutting down borders, responding to things. A lot of them have been reactive. And it would be great because it is these reactive responses that have seen a rise in the number of cases and the way it has spread, from country to country, and even cases rising in countries. So I think it would really, really be great, for once, if we can have a proactive government in, the various countries. I think that is what we are looking to.
Yeah, indeed. Great.
Excellent point.
Great
If I could just get a very quick wrap up from each one of you, because we're running out, so about 20 seconds each. What is most important in political messaging here going forward in this pandemic? And Mr. Kuhn, we'll start with you.
Okay, great. I just want to say President Trump is the representative of the working class. He created a new movement that has taken on its own dynamic. And this movement is a sign of true, successful democracy and freedom. And that's what this is about. We need to move forward together. We need to make sure that we crush this pandemic the way that we know we can, because America is always about finding solutions, not pointing out problems.
Dr. Ullman.
The same thing here in Europe. Europe always looking for solutions and not only pointing to problems, because that would be very boring for a politician, but we need stringent rules that have to be followed and be accepted by the population. Because if you have stringent rules how to react in a pandemic situation as this is right now, you could receive the rest of the population to accept those rules and follow those rules. Then only together as a global community we can fight this pandemic, and not as a state alone.
And Dr. Ezenwane, you have the last word.
I'm just going to say that, none of us have ever really experienced a pandemic before. And this is new to really everyone. So it would be great if we continue to look to science, continue to look to research, and follow what is being offered. Make sure we fund science, fund research, and take to the solutions that they're preferring. It would be bad, especially for political instability, if we keep just moving motions, which we've seen with a lot of the leaders. We should follow what is best for the people. I think that would be great in crushing the pandemic, and knowing that whatever affects one country affects the other. We are only as strong as our weakest link.
Amen.
That is a great point to leave it, I would say. Thank you all to my guests for a very spirited discussion there. Stephen Kuhn, Andrew Ullman, and Folakemi Ezenwane. Great to have you with us. Thanks again for joining us here on DW. And